telehealth has created the opportunity to bring care virtually to anyone, anywhere. The pandemic created a need that telehealth filled for patients who required access to medical treatment when safety protocols restricted in-person visits. Both providers and patients quickly realized the added benefits. Telehealth provided a new healthcare connection so that patients no longer needed to take time off from work, find childcare, sometimes drive great distances, or spend extra money to see a doctor face-to-face. Patients only needed access to a phone or computer to receive great care at home. Did you know that telehealth supports a wide range of healthcare? From seeing patients with a simple rash to patients with complex heart disease. Telehealth truly delivers care to people who otherwise may not have been able to see a doctor. So smaller communities typically do not have the specialty care larger cities typically see. Telehealth brings specialty care to all at a time and place that is most convenient for both patients and providers. Last October, a provider in our health system saw a farmer who was in their tractor harvesting their crop. The farmer stopped the tractor, had their visit with the doctor from the cab of their tractor, then went right back to work. If telehealth wasn't an option for that farmer, he would have missed a whole day of harvesting. The farmer shared with us if it had not been for this technology, he would have canceled his appointment to get his crops in before the weather changed. As you know, high-speed internet broadband is important for countless reasons, including getting the best connection for telehealth video appointments. Did you know that in the fall of 2020, Governor Kelly signed an executive order establishing the Office of Broadband Development? The order designated nearly $50 million to the Connectivity Emergency Response Grant Fund. The money was for the installation of broadband cable lines to communities lacking in high-speed internet across Kansas. Now, more than ever, Kansans have the internet access they need for telehealth because of the investments in broadband made possible by your state legislators. Parity simply means the ability for providers to receive the same amount of money for a telehealth visit as they do when seeing patients face-to-face. This is incredibly important. As many of you may know, we currently do not have permanent parity in the state of Kansas. This is incredibly important to sustain telehealth as we use it now to benefit patients. Before the rules around parity were temporarily changed, we typically saw about 100 patients via telehealth a month. When the COVID-19 pandemic hit, swift action by state legislators led to relaxed telehealth rules and new pay parity for telehealth visits. Patient demand for telehealth soared to over 1,400 visits a day. Today, we still see anywhere from 600 to 700 patients daily via telehealth. Patients and providers have come to know and trust telehealth. Providers cannot continue to offer these services if payment isn't in line with the cost of the service. Clinic staff are still doing intake for patients. Providers are still spending quality time with their patients. Nurses are still providing care coordination and patient education. Just as with face-to-face care, the cost of patient care still exists with each telehealth visit. Ending or minimizing pay parity for telehealth services jeopardizes this avenue of care for everyone. Rules enacted by legislators in the early days of the pandemic allow for current temporary telehealth changes to sunset in 2022, unless lawmakers act soon. If no action is taken, the barriers to healthcare, specifically telehealth, that existed before the pandemic will return. This would be an unfortunate step backwards for providers and for patients. Patients won't enjoy the privacy and comfort of in-home visits with their physicians, or the convenience of a call from their work, even if it's from a tractor. Without continued access and parity in telehealth, our patients' continuity of care could suffer, and the ability of specialists to meet our patients where they live will be greatly reduced. Kansans will lose the kind of personalized care out-of-state online doctors won't and can't provide. Legislators can help by ensuring reimbursements for telehealth visits continue at in-person rates, and by removing geographic restrictions allowing patients to be seen when and where it is convenient for them. Legislative changes would also allow Kansas providers like me to continue to advance the future of telehealth and embrace new technologies.